Now coming to the female reproductive system. The female reproductive system is also under the influence of two same hormones, that is FSH and LH, follicle stimulating hormone and luteinizing hormone. This LH can act on a specific cell called as theca cells, thecal cells. What they do is they will produce a substance called as androgens. They also produce the androgen, further which it can be converted to an estrogen. Usually, most of the times when we read DSDs also, we always saw whenever more androgens are there, they will be obviously converted to an estrogens. So this is done by with the help of another cell called as granulosa cells. And in the male reproductive system, we saw the Sertoli cells is producing the inhibin to inhibit the FSH. Here, who is going to produce? Here, the granulosa cells are going to produce the same. That is called as inhibin B, subtype B, which is inhibiting this FSH because it's like a feedback loop which has to inhibit whenever excess granulosa cell action is there. Then the female reproductive system will be divided into various stages. First, starting with the puberty. Puberty, what happens in puberty? There are stored follicles in the female, but they get matured only after the pubertal age. So what happens in before puberty is the GnRH tract is immature. So first thing is the GnRH axis should be mature. So the tract maturation is the first thing that is required. Then the hormone should be produced in a pulsatile manner. Only this pulsatile manner can stimulate the follicles. That's why what they can do is using the same GnRH, we can treat both precocious puberty also and delayed puberty also. If it is a delayed puberty, what you have to do? You have to give it in a pulsatile manner. Pulsatile manner in case of a delayed puberty. So whenever it is pulsatile, then it will activate the GnRH axis, GnRH FSH axis. So coming to GnRH, it can be given in a continuous manner. If it is given in a continuous manner, what will happen? It is pretty simple. Now continuous manner, GnRH axis will be inhibited. So what has happened? It is given for precocious puberty or an early puberty. So these are the same thing can be used depending upon the nature or the duration that we are giving, whether it is pulsatile or in a continuous manner. Then for attaining puberty in females, a critical body weight is essential. That critical body weight should increase. That's why men or females who are little obese, they attain puberty a little earlier. So what happens whenever this critical body weight is increased? So there will be production of hormone called as leptin. The leptin level starts to increase. They sense the adipose tissue and the leptin level starts to increase. Then what happens is, then they will produce a substance called as kisspeptin. They will produce a substance called as kisspeptin. This is very important, this kisspeptin. Then what this kisspeptin will do? They will obviously stimulate the GnRH axis. GnRH axis, they will be stimulated and they will start producing in a pulsatile manner. So that is why a critical body weight is always required for attaining a puberty. That's why thin individuals, they have a delayed puberty. Then what is the sign of puberty in case of a female? The first sign is telarchy, that is formation of breast bud will happen. Then menarche will start, which is the start of menstruation. So this is the pubertal things we have to remember about leptin as well as kisspeptin. Now coming to the menstrual cycle. Menstrual cycle, these are cyclical changes happening not only in the endometrium. Please remember, it is the changes which is happening in other places also, like the ovary, endometrium, then breast, cervix, everywhere. All places there are cyclical changes which is happening. But predominantly cyclical changes happens in the ovary and the endometrium. So coming to the ovarian changes, what happens in the ovarian changes? First thing that happens is the follicular development. There are two phases called as follicular phase and second phase is called as luteal phase. Luteal phase. In follicular phase, the follicles develop, whereas in luteal phase, there is production of corpus luteum. There is formation of corpus luteum. So coming to this follicular development, see this diagram carefully. First, what happens is there are stored follicles in the women inside the ovaries. This is the diagram of an ovary, whereas there is a stored follicle. Out of this, the first and foremost follicles are called as primordial follicles. They are called as primordial follicles. Out of this, what will happen? Some will be recruited. Every month, some of them will be recruited. So around 15 to 20 follicles are recruited. and out of this 15 to 20 follicles, one will be chosen. One follicle will be chosen for developing into a mature follicle. How come this one follicle is being chosen? There is a reason behind it. Whichever follicle is having high number of FSH receptors, so obviously the FSH should act on it for the follicle stimulating hormone to act on it to produce or mature the follicles. It will have high FSH, and whichever is having high aromatase, it is like a natural selection which is happening. So whichever is having high FSH as well as aromatase, they will be chosen, and finally they will form the mature ova. They will form the mature ova. And after the fusion process, what will happen? They fuse along with it, and finally they will release the ova. Release the ova. After this, what will happen is there will be slight hemorrhage around this capsules. That is called as corpus hemorrhagica. And after some time, this hemorrhage is usually replaced with the fat droplets. They are replaced with the fat droplets. So this fat droplets are called as corpus luteum. Luteum is the term used for fat droplets of the yellowish color. So corpus luteum, it is little whitish in color because of this fat droplets along with the, then finally they will form a scar tissue. They will form a scar tissue. So this corpus luteum has two, it can go to a two different forms depending upon the occurrence of fertilization. So as and when fertilization is happening, suppose if fertilization happens, let's see, when fertilization is there, what is the requirement of it? This corpus luteum will help for the embryonal implantation and survival for a few days until the placenta is produced. For a few days to weeks until the placenta is produced. So this fertilization, if it happens, what will happen? The corpus luteum is going to stay. Corpus luteum stays. If they don't, no fertilization happens, no fertilization, what will happen is it will form a fertilization. If no fertilization happens, what will they form? They will form a corpus albicans. Corpus albicans, which is a scar tissue. They finally form a scar tissue. So this is the survival mechanism of the corpus luteum. Depending upon various whether fertilization is happening or not, it is going to choose its fate. Then finally coming to the menstrual or the endometrial changes. This endometrial changes happens in three different phases. First phase is called as the menstrual phase. Whenever there is a flow of menstruation, that is called as menstrual phase. Then second phase is called as proliferation phase. The second phase is proliferation phase. What happens here? There is proliferation of the entire vasculature that is present in the endometrium. The endometrium is going to get proliferated. So third phase is called as secretory phase. Here lots of secretions are going to happen, and this is the third stage. So the duration for each of them is first 5 days, 1 to 5 days happens the menstruation. Then 5 to 14 days, in a normal 28-day cycle we are talking, 5 to 14 days, what is going to happen? Proliferation is going to happen. Then the secretion phase lasts from 15 to 28 days, 15 to 28 days. On the 14th day, there is an important event which happens, that is ovulation. So this is the entire cycle. So first cycle starts with endometrial shedding. Then what happens? During the proliferation, the endometrium is getting proliferated and it attains a special thickness, that is the endometrial phase. And what is the most important hormone responsible for this? The hormone responsible is important, that is estrogen is the most important hormone, which is very, very essential for the proliferation phase. Then coming to the secretory phase, progesterone starts to act, but again estrogen also helps, but predominantly progesterone starts to act. Then coming to this event which is happening on the 14th day, which is very, very important, the ovulation. So during ovulation, what all things can happen? During ovulation, there can be a pain because of the fluids that is produced, and they go and occupy the cavities in the abdomen. So that will cause a type of pain which is called as Mitchelmus pain. This is important. Next thing what happens is, what is the reason for this ovulation? Both LH as well as estrogen, both of them, their levels increases. But out of that, LH surge is more important for ovulation than an estrogen surge. And this LH surge is a kind of positive feedback mechanism. So these are the events that is happening in the endometrium. So we have to remember the hormone, that is the estrogen, progesterone, as well as this LH surge. So these are the classical events that happens during ovulation. Now coming to the pregnancy and lactation. During lactation, what happens is, even during the pregnancy period, there is breast development happens. This breast development happens specifically because of an hormone called as estrogen. This estrogen helps, even though the progesterone also helps, but breast development predominantly happens because of estrogen more than progesterone. That's why whenever we were discussing the disorders of sexual development, we were constantly indicating that estrogen is responsible for the development of breast. Even in the males, whenever there is an insensitivity, what was happening? There was development of breast or a gynecomastia was happening. Then milk production. There are two questions. One is the milk production and milk ejection. This milk production happens because of prolactin. It is a lactin. So prolactin is an hormone which is responsible for milk production. Whereas milk ejection is done by oxytocin. Milk ejection is done with the help of oxytocin. So these are the important points. Now coming to the final end event that happens in females, that is the menopause. What happens whenever these follicles are constantly being used? They will end up having burnt up ovaries. So what will happen to the estrogen levels? The estrogen levels are going to drop. Then because the feedback inhibition is not happening, the FSH and LH levels are going to shoot up a lot. At the same time, the lady or the woman will start developing osteoporosis because estrogen was protecting them from this osteoporosis. Now that is not there, so obviously they will develop osteoporosis. And the most common symptoms is the vascular symptoms. What happens is there is sudden vasodilatation which can happen because of the imbalance of the hormones between estrogen and progesterone. So what can happen is there is flushing or heat generation. And during the endometrial ovulation phase also, what can happen is there is a surge of progesterone. This progesterone is a kind of thermogenic action will be there. Thermogenic action will be there. That is why there is a method for assessing the ovulation which is called body temperature monitoring, which increases immediately after ovulation. And that is because of the progesterone surge which is happening here. Now coming back to the flushing and heat generation, this is imbalance between the estrogen and progesterone, and suddenly a vasodilatation can happen. Then they might develop cardiac disorders. Usually before menopause, females have a cardio protection activity. What does this estrogen usually can do a little vasodilation. So this vasodilation is usually protecting the females from cardiac disorders. So cardiac disorders prevented. But what happens after menopause? Estrogen itself is reduced, so cardio protection action is not there. That's why when you compare a male-female ratio of myocardial infarction, before menopause it is more in the males, but after menopause the proportion becomes almost similar. So these are the events that we should know in a female reproductive cycle. This brings us to the end of reproductive physiology.